Hello, everyone. Good morning, good afternoon, and good evening, depending on where you are in the world right now. My name is Lars-Åke Söderlund, and I am one of the vice presidents of the International Pharmaceutical Federation. I will be your host as we sit down over a virtual cup of coffee to explore the big topics shaping pharmacy practice today, starting with the essential role pharmacists play in the prevention and management of non-communicable diseases or NCDs. So welcome to this episode of Coffee with FIP, a podcast-style mini-series designed to provide pharmacy professionals around the world with a dynamic platform for informal, evidence-based and CPD-aligned discussions on key and timely topics in pharmacy that reflect FIP's strategic priorities and programs. And we can say, brewed especially for pharmacists and healthcare professionals who are passionate about making a difference. One focus, one conversation, one topic at a time. Please note that the views and opinions expressed in today's episode do not necessarily represent FIP's official position on the topic unless explicitly stated. So today's episode is planned around the theme Pharmacists at the Frontline, tackling NCDs together. And with me today is Derek Connolly, Chair of the FIP Board of Pharmaceutical Practice, and Emma Paulino, President of the National Pharmacy Association, ANF, in Portugal. Hello, Derek and Emma. How are you today?
Good to hear your voice, Lars-Åke. Hello, Emma.
Hello.
Can you please introduce yourself very shortly?
My name is Derek Connolly, and Lars, thank you for the introduction. I am indeed Chair of the Board of Pharmaceutical Practice at FIP. But much more importantly, I am a community pharmacist in Ireland, and I continue a tradition, which is 3 generations now, of looking after people's health through community pharmacy that goes back to when my grandmother qualified as a pharmacist in 1925.
And I'm Emma Paulino. I'm a community pharmacist from Portugal, and I'm currently also the president of the National Pharmacy Association. I think it wasn't a prerequisite for this session in particular, but I'm also a 3rd-generation pharmacist myself. So both my grandparents were pharmacists from my mother's side, and I'm very happy to be with you today to discuss this topic.
Thank you so very much, both of you. It's indeed a great honor and pleasure having you both with us today. And, in today's conversation, we will dive into the growing burden of non-communicable diseases and how pharmacists are uniquely positioned to lead in the prevention, patient education, and long-term support. And actually, NCDs are responsible for 3/4 of all deaths globally, placing a significant burden on individuals, communities, and health systems. So I think it's time to start. Grab your cup of coffee, settle in, and let's get started. So I will ask you some questions, and I would ask you, both of you, to respond to the questions. But I will start with you, Derek. What are the current challenges and opportunities for pharmacists in tackling NCDs across different healthcare settings, and how can interprofessional collaboration enhance their impact?
We know as pharmacists, it doesn't really matter in what area we practice, whether that's in community pharmacy, in hospital pharmacy, or in those fantastic roles that are growing and growing for pharmacists, where they help to back up patient-facing pharmacists. But just from my own perspective as a practicing community pharmacy, Lars, what we know to get best value from our healthcare system for growing populations, which are growing because people are living longer and fuller lives, is we must have more early interventions into people's healthcare, and that must be based in a spirit of cooperation or a spirit of concordance with those people. I think the unique position that pharmacists find themselves in is that they are medicines experts, which also means they are experts in those disease states. But really the key and the most important factor of what we can offer the communities we serve is our knowledge, is our accessibility. So by being able to start early conversations with people about their health, and then to talk to them about having to either live with non-communicable diseases, be it COPD, be it heart disease, be it diabetes, or any other non-communicable disease, we can help them to have more control in their lives. We can help them to get better outcomes. And I think what that means is that we can free up capacity in the rest of the healthcare system through early interventions, which have always been proved to get better outcomes. I think the second part of that agreement, if we want to call it that, is when we as pharmacists go to the people we serve and we ask them what they would like us to do more of for them, what would they like to see happening in their community pharmacies. Every time those questions are asked anywhere around the world, people have a huge trust and confidence in their pharmacists, and these are exactly the things that the people want us to do for them. So this is a win for the patient, it's a win for the healthcare system, but actually it's a win for pharmacy as well, because pharmacists themselves want to be able to help people using their skills and their expertise.
Thank you, Derek. What are your thoughts, Emma?
Well, I really agree with what Dara has said, and I will just add that, in fact, that accessibility that we have and the opportunities that we have early on when we are considering the patient journey are really unique to pharmacy as well, because we know, as Dara said, that people are living longer and fuller lives, and we know that a lot of people are actually living with non-communicable diseases more decades of their life than they are living without non-communicable diseases. And I think that this is a challenge for the overall healthcare system and for individuals, of course, also in terms of the burden to the healthcare system and the sustainability of healthcare systems overall. So we really also want to take every opportunity to delay the onset of non-communicable diseases, and we want them to be controlled. And the pharmacist is really in a unique position to do that, because we are the healthcare professional that contacts people during the decades of their life where they don't think they need healthcare services, but they do visit community pharmacies often to get access to non-prescription medicines or health advice in general, or other healthcare products. And those are really opportunities to identify people at risk and at the same time to implement lifestyle choices and talk about lifestyle choices that can really delay onset of non-communicable diseases, or even allow us to prevent those non-communicable diseases. So we have this opportunity early on in terms of the patient journey that other healthcare professionals often do not have. And once people have a diagnosis, we are the healthcare professionals people see more often. So, for instance, in Portugal, now in practice, it is possible for a physician to prescribe for non-communicable diseases for the duration of a year. But the person has to go to a pharmacy at least every 2 months to get the medication they need. So that means that while they see the physician 1 time per year, they will see the pharmacist at least 6 times per year. And this, again, allows us to identify any uncontrolled diseases, identify any adverse drug reactions, and situations where the adherence to the medication can be put at risk, and early on to intervene and assist people in managing their own disease, because as Dara was mentioning as well, we really need to be working not only within the multidisciplinary team, but very close to the person who has a non-communicable disease, because at the end of the day, it is that person who will make the choices and take the medication. And as a previous Surgeon General from the US has said, medications do not work in people who do not take them. So and this is particularly important in non-communicable diseases.
Excellent. Very interesting development of the pharmacist's role in NCDs in Portugal. Thank you so very much. Derek, how can pharmacy services be integrated international strategies for NCD prevention and control? And is it important that these services or the pharmacy is integrated in the national health strategy? What are your thoughts?
I love this question, Lars, because I become a bit cheeky and I turn the question on its head and I say, what is it that healthcare systems can do to integrate into the excellent system we have in community pharmacy of relating to the people that we serve, of using the fantastic databases that we have in community pharmacies, and also by that interaction that Emma so rightly highlights, that we have with people on an ongoing basis. How can healthcare systems adapt to harness that power that we have within community pharmacy, not just through the resource that is the human capital of pharmacists and their teams, but also the data that we store in community pharmacies. Emma and I both take a long view on pharmacy because we are acutely aware of how much things have changed in our parents' generation and also in our grandparents' generation. But what we have always seen, Lars, is pharmacists are hugely adaptable to new technology. So if you think of the integration of the telephone, or if you think of the integration of the telegraph, maybe 100 years ago, that we could communicate better with the pharmacy supply chain and then with our own patients. If you think of into our parents' generation, the first person in my town who used a computer in their business was my father. And he was able to use the computer to generate more legible labels so that there was better communication with his patients. Those labels then, because they were stored on a database, that database became a computerized, a digitalized patient medication record. And from that, we were able to harness that data to be able to more efficiently serve people. I think we also now have, fallen into this rabbit hole of how amazing artificial intelligence is. But pharmacists in community have been using artificial intelligence since, I think, 1987, where we have artificial intelligence computer programs to highlight drug interactions to us. So none of this is new. But if you consider, when did other healthcare professionals start to digitalize their medical notes? I can safely say that I think it's only within the last 3 or 4 years in Ireland, as an advanced country, has been able to say that patient medication records and GP surgeries are digitalized. And I can safely say there is no hospital in Ireland that has every patient medication record or notes digitalized. So to go back to answer the question is that this is not about integrating pharmacy into the healthcare system. This is actually about figuring out harnessing what we already have in healthcare systems and making them work more efficiently. We are at an interesting juncture here in Ireland where for lots and lots of years, we have been talking about what a good modern healthcare joined up thinking system looks like. And we're getting very, very close to those things that can make that work by harnessing artificial intelligence, by harnessing digitization, by harnessing better communications. And it's starting to happen. I think probably to really focus in on this, particularly when we look around the world and see where this really, really works. When pharmacists can see the patient interactions that people have had with other healthcare professionals, we are in a much, much better and advantageous position to be able to give people much better advice and to think through how they can get better results from their medication or the lifestyle changes that they need to make, because we can see the interventions that other healthcare professionals have made. The most frustrating part of being a pharmacist, whether that's in a hospital setting or in a community pharmacy setting, is not understanding the logic of why a medicine or an advice has been given to a patient because we don't have access to the notes. The groundbreaking thing that's going to happen with the integration, Lars, over the next few years is I think, could even move away from what we physically think of as a prescription. I would love to have a scenario where somebody would come to my pharmacy, and I know that Portugal is a little bit more advanced than Ireland, but I would love to have a scenario where somebody would come to my pharmacy and I would log in with their permission and with their agreement to their patient medication records or their notes to see what the last interaction they had with the healthcare professional was, So I can either dispense medicines for them, administer medicines for them, review medicines for them, or prescribe medicines for them, because those are the four essential skills that I can bring to add value to the healthcare system. By having access to the patient notes, there's also then it becomes a two-way communication, because the other healthcare professional who's involved in looking after another aspect, whether it be non-communicable disease care or not, can see the interaction that I have had as a pharmacist and the value that I have added. So if you think how virtuous that is, that will also mean that there won't be a duplication of effort and the care will be more streamlined for the person. An added advantage of that, Lars, would be that we are very worried about people who have addiction to prescription and non-prescription medicines. It makes it easier for us to have their care because we can see what their patient journey looks like. And the other one that we're also very scared of as well are falsified medicines and illicit medicines. And it helps us to give a fuller and a more holistic service to the people that we serve. So that's my what I would call pharmutopia. If I was able to say, how would we better look after people? It's going to have to happen through an integrated healthcare system, but it isn't. And I think we really, and I have no fear in ever saying this because I know that other healthcare professionals agree with me. We have to move away from this patronizing and patriarchal structure that has existed for hundreds of years within healthcare, that one profession has primacy over another, that one profession says how high and everybody else jumps. The world has moved on and it doesn't work like that anymore.
Thank you, Darag. Yes, you're correct. The transformation of healthcare with pharmacy integrated. And that's really nice. Emma, what are your thoughts?
Well, I'm happy to say that in the last couple of years, we have moved in Portugal towards more or less the concept that Daryl was talking about. So I mentioned before that physicians can, for NCDs, prescribe for a year, and this is exactly what happens. Prescribers in Portugal have moved from prescribing boxes, a number of boxes for medication, and they prescribe for 12 months. The pharmacist can dispense every 2 months the medication that the patient needs to fulfill the prescription and to be able to take them as directed by the physician. If something happens within those 12 months, the pharmacist does have some flexibility in terms of adding more boxes. For instance, if the patient has lost a package or something like that. So there is some flexibility. So and this is an important move in terms of the concept of moving towards duration of time, a prescription line, and not so much a number of packages that the patient can take from the pharmacy. We also can access the medication history. For now, we can access the medication history for the last 12 months, but we do have information from all prescribing sources. So if the patient has gone to the national healthcare system or the private sector or the social sector, we will get to see all prescription lines that the patient has had in the last 12 months. And we also can see whether those medications have been dispensed or not, whether it has been in our pharmacy or in another pharmacy. So we have an integrated picture of what has happened regarding those prescription lines in the past 12 months. Besides this visibility, which we can then use, as Daryl was saying, to engage in conversations with the patient about adherence or about any duplications that we might see that the physicians themselves have not identified. Well, we can also send what we call therapeutic notes to the physicians. So if we identify anything that we would like to convey to the prescribing physician and also to the general practitioner, we can use our information system to send a note to the physician so that he can consider that information from the pharmacist in the next patient appointment. So this is a beginning of a conversation between the physician and the pharmacist that we hope that we will be able to expand in the future. We are moving towards having a unique patient record in Portugal by the end of 2026, where we will be able to, basically comply with the legislation that the person, him or herself, is the owner of the data, and he or she can share that data with whomever, the healthcare professionals that the person believes are the members of their multidisciplinary team. And we will be able to have access to read the interventions made by other healthcare professionals, and we are going to be able to register that information ourselves. So I think that we are moving towards having a more integrated system whereby multidisciplinary teams that are working in different settings will be able to have a more complete picture of the person, and we will be able to work as a team. I will only add an example. I don't think that we need to have these kind of developments in our countries to promote a bigger integration of pharmacy services into national strategies. For instance, in vaccination, a topic that FIP has been working a lot, and rightly so, because it's so important also to prevent some NCDs. In vaccination, in Portugal, we are complementary to the healthcare systems to administer vaccines for flu and for COVID-19. And even before we have this national unique patient record, we have managed to share vaccination records and to have this information in order to be able to administer vaccines safely, and also to be able to update the vaccination record. And this has been a successful strategy in the last 2 years in Portugal, having this vaccination effort jointly with healthcare centers, and we have contributed to the good vaccination coverage in Portugal through this specific pharmacy service as well.
Thank you, Emma. Indeed, the beginning of an interprofessional collaboration and a streamlined integrated care. Very interesting. Well, the United Nations will very soon have a political declaration on NCDs. And in the lead up to this declaration on NCDs and mental health, how can pharmacists strengthen their role and influence policy? What are your thoughts, Derek?
I think it's really important that when we talk about healthcare policy, Lars, that it's just not something we talk to the Department of Health, for example, within a particular country. I think where we see the best thinking about healthcare in progressive countries is where every department must consider what are the healthcare impacts and what are the lifestyle impacts that any particular policy will have. So a very interesting way of looking at that is, it is healthier for people to be able to walk and to engage in a community where it is safe to walk to where they need to go. So when we consider things that we would have as social prescribing for the people that we serve, it's always going to be better for people to be able to be physically active, to have lots of interaction within their own communities, and to be able to interact and encourage other people to have those healthier lifestyles within their communities. The things that we can do as community pharmacists that make us unique, but also where we must then accentuate that when it comes to policy, whether that be at the United Nations or at the World Health Organization, is to say that those conversations can happen most easily in a community pharmacy, because it's the open door of the healthcare system. And I think probably we can maybe sometimes get a little bit caught up with nomenclature and labeling things, because that's what we do, because we're pharmacists. We have an interesting conversation in FIP at the minute as to what we call people. Should we call people patients, or should we call them customers? Should we call them clients? And I think probably I just seem more comfortable with people rather than patients. I, in my own head, would think that if I asked most of the people who come to my pharmacy, are they my patient? I don't think they would consider themselves to be a patient. I think probably most Irish people would consider themselves to be a patient if they were on a trolley in a hospital and they had been hooked up for a drip and there was lots of wires coming from them. So the point of the matter is that if we are to accentuate what it is that we can do for people, I think we need to look outside of what healthcare is and to start to have conversations with, say, a Department of the Environment here in Ireland to encourage them to say that as they look for planning permission to have a new school or a new hotel or whatever that might be, how easy is it to walk to it? And then you also say to yourself, what are the facilities that are within a town like the town I live in for clubs and societies, for people to have human interactions with each other, where they can talk to each other about their health and their health care, whether that be their mental health or whether that be their physical health. So as far as the policy is concerned, pharmacists are embedded within those communities and are a huge resource for when planning comes to happen to say is, what can we do in this town or in this suburb or in this city or in this village to make this a more livable place and a better place to live? And ultimately, I think what that also means is within those considerations, Lars, we have to say, is there a sustainable model for community pharmacies in the communities where people live? I am acutely aware of huge amounts of pharmacy closures in our closest neighbor in the United Kingdom. And also we are very, very aware of an upheaval that's happening within community pharmacy in the United States of America, where it seems that people, rather than having more access to community pharmacies, are actually having less access. What that means, I think, really down to a nuts and bolts level, Lars, is that when we look at what pharmacists do and our core four functions of dispensing medicines, reviewing medicines, prescribing medicines, and administering medicine, I think most systems pay pharmacists to do maybe two of those four things specifically, but they don't pay them equally for their time for all of those things. So if we are to do more in the space of services which are to review and to prescribe, we need to be paid to do it. So just like Emma said, we need to move away from this idea of prescribing boxes and dispensing boxes. We need to see community pharmacists paid for the value that they add through the knowledge that they add and through the adherence and the better outcomes that come from the skill set that pharmacists have. So what that means is that if I am a young pharmacist and I want to invest my future into a community that I can serve, I must know that I have a sustainable future for my family, if I'm going to have a family in that community, but also for that community to know that I'm going to be there for the long term. So that must be reflected in policy, which says this is how we fairly pay pharmacists for the value that they add. Pharmacists want to do more for people, but if the payment for those services doesn't exist, they can't be done. So that would be my big message to anybody listening to this, to say, how do we have a sustainable future? And what does this policy for sustainable pharmaceutical care look like? It has to be that we are paid properly for the services and the value that we add.
Thank you, Derek. Very interesting thoughts. Emma, over to you.
Well, thank you. Well, I think that to add on what Dara said, and I completely agree, I'm a firm believer of combining the top-down and bottom-up approaches. So when we are talking about how we can strengthen our role and influence policy, obviously, I think there's an important role for national organizations and FIP to ensure that pharmacists are at the table when we are discussing these policies and when we are discussing healthcare system organization and how we can distribute people into the levels of care that are most efficient and where they can get the best care that responds to people's needs and expectations. So, of course, it is important that we strengthen these organizations in order for them to be able to influence policy. But it's also very important that as individuals in our community pharmacies, that we also demonstrate what we can do. As a pharmacy leader in Portugal, I have often interacted with politicians that have described their own experiences with their pharmacies, or have described good experiences that their parents or grandparents have had with community pharmacy, and that is so powerful in terms of really reinforcing our narrative. So I think that we all have a role to play, organizations and individual pharmacists, because when we are changing the health indicators through our interventions, we are contributing to this narrative, and we are contributing to influences these changes in policies that do include the pharmacist's role and our potential in terms of what we can do early on in terms of the patient journey, or even after people already have their diagnosis. So I would really encourage people on the one hand to exhibit these behaviors in our day-to-day practice, that is so important, but also to strengthen our national organizations and organizations like FIP, who can really be at the table when these topics are discussed.
Thank you so very much. It's really interesting and really nice to discuss this very important topic with you today. Before we end our podcast for today, Derek, would you like to give our listeners worldwide 1 minute take-home message?
I don't have enough time in a minute, but I'll do my very best. I just worked it out. I'm in my 4th decade of practice as a community pharmacist, and I still have a huge enthusiasm for what I do, because listening to Emma and knowing the fantastic work that she has advocated for and making happen in Portugal shows us all the future and what it can be. And I think the future for pharmacy, be it in community practice or hospital practice or any form of practice, and I think the other thing to say is it's great that pharmacists and move within their working lifetime between those different areas of practice. I think that the future is really, really positive. I think it's built on a fantastic foundation. That is the trust that people have in what we can do. And that's the bottom line. People trust us for what we can do because we have that accessibility, but also the fundamental competence that we have. What I'm starting to see around the world through working with really interesting people such as yourself and Emma and everybody else at a national level and international level is there's a coalescence that's happening between legislators, regulators, people involved in world policy, payers to say, hang on a second, we can do this better and we can see the examples of where it's worked. I think what we need to do, exactly like Emma says, is from the ground up. The best advocates for community pharmacy or any type of pharmacy practice are the people who do it. So I think each individual pharmacist has to advocate for his or her own practice, but that also has to be led from top down, like from the leadership positions that we find ourselves luckily within an FIP or national organizations. We have to show people how to do it. So I'm hugely enthusiastic about the future of pharmacy practice. Its adaptability, and the whole time it just becomes more and more interesting as we do more for people and get better results.
Thank you, Derek. Emma?
Well, I would like to paraphrase our dear late FIP president, Dominique Jordan, who said that this will be the century of pharmacists. I think that I am as enthusiastic as Dara just conveyed, because I am an optimist by nature, but at the same time, I'm seeing such a move towards really accepting or not even accepting, but harnessing this potential that community pharmacy has in terms of contributing to healthcare indicators and really integrating with what is offered by by other healthcare professionals and other healthcare institutions. That I really see a future where we will be able to more easily contribute to these healthcare indicators, because we do need, as Dara said, the conditions to do so. And that is based on a fair remuneration system, but also in terms of what the education of pharmacists has to be, and the organization of the pharmacy sector overall. Mostly what I think is important is that every pharmacist and every pharmacy leader really acknowledges that we have unique opportunities right now, because we are looking at increased needs, increased expectations from people, and pharmacy is really at a position where we can really contribute. And I would say that the most important and most changing attitude that I have seen in community pharmacy is us understanding that it's not anymore that our role is on ensuring that people have the right medicine at the right time for the right person at the right dosage, but really looking at patient outcomes, really looking at people outcomes and their quality of life, as well as clinical parameters. And when we do understand that our role is not to dispense those packages, but to contribute for non-communicable diseases, for instance, which is a topic of our conversation, to be better managed in the community, I think that there is so much more that the pharmacist can offer besides the dispensing, which has traditionally been our role. We do have a lot of other services in community pharmacies that contribute to optimize medication efficiency and safety. So there are huge opportunities out there. So my last message would be one of optimism, but also a little bit of ambition in terms of what pharmacists and pharmacy organizations can do better for patient outcomes.
Thank you so very much, both of you. To conclude, we have discussed the need for early intervention because pharmacy has a unique position as medicine experts, but also we are accessible and we can start with an early communication with the patients. It's important to delay the onset of the disease, and that also is related to lifestyle issues, but also to a broader perspective of different areas within the communities where actually pharmacy can contribute to a better life in health, so to say. We also need to discuss how healthcare systems can use the fantastic pharmacy system in a better way to integrate both of them into each other, transform healthcare with an integrated pharmacy. And we also discussed how vaccinations actually also can play a very important role in preventing the onset of these diseases. And of course, the lifestyle support, but also the importance of pharmacy being part of a national health strategy and remunerated or paid according to the value, adherence, outcomes, etc., that we provide to create a society, a life in health. So I think it's very clear that pharmacists are accessible and a trusted healthcare professional. We are well placed to support prevention, early detection, behavioral changes, therapeutic optimization, and people-centered care through evidence-based services across community, hospital, and primary care settings. But addressing NCDs also requires more than individual action. It demands interprofessional collaboration and coordinated efforts across the healthcare system as such. So I think that you both ended this podcast in a very positive way. It's a bright future for pharmacy, but we still need to get some policy changes. But the future is indeed very bright. And of course, pharmacy has an essential role to play when we discuss NCDs. Pharmacists are at the front line tackling NCDs together with other healthcare professionals. Thank you so very much, both of you, for sharing your wisdom, your experience in this very important topic for the upcoming meeting with the United Nations later on this year. Finally, I would like to say that All this builds on FIP's long-standing work in this area, including the FIP Statement of Policy on the role of pharmacists in non-communicable diseases and the FIP Practice Transformation Program on NCD, and also reinforces FIP's commitment to advancing the role of pharmacy in improving global health outcomes. NCDs is one of our most prioritized programs within FIP, and you can also find many more resources on related topics to FIP. For example, if you look at the ncd.fip.org website, you will find lots of resources related to NCDs. And also, for example, when it comes to tobacco and nicotine cessation, which is also linked to this topic of NCDs. Thank you so very much, all of you, for listening to this Coffee with FIP episode. And please check out the FIP website for more resources and episodes to come. Thank you so very much, and goodbye.